President Biden says the United States will reach his goal of giving out 100 million COVID-19 vaccines today, a goal he promised he'd reach within his first 100 days of office. And as the vaccination effort ramps up here in the U.S., the CDC has updated its guidance to reduce social distancing in schools from 6 feet to 3. For more on this, let's bring in Dr. Bob Lahita. He is the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health and a professor of medicine at Rutgers and New York Medical College. Good to see you, Dr. Bob. So a recent study out of Massachusetts showed that students who sat 3 feet apart from others and wore their masks did not have an increased risk of infection when compared to students who sat 6 feet apart. And we're still dealing with a high number of cases and working to reopen schools. So does allowing students to sit closer together make good sense?
Well, it's really up for grabs, Vlad. Right now, there's a lot of debate. The CDC still said 6 feet, and the teachers union says 6 feet. But everyone else is saying, well, 3 feet's more than enough, especially among children, where the transmission level is exceedingly low. And of course, where children, when they get this virus, there's really virtually no effect. So space issues in schools are really, really important. And I think we're going to see that distance in schools really doesn't mean that much, particularly if the children wear masks. And as you also know, there's a move afoot to have the vaccine tested between 12 and 18-year-olds and between 6-month-olds and 12-year-olds. So Moderna, in particular, is going and looking at the children population. But 251 school districts in Massachusetts are the ones who showed that only 3 feet distance is probably okay and important.
President Biden released a video late last night announcing that the U.S. was on track to reach his vaccination goal. I want to play a little of that video for you.
Folks, tomorrow we're going to hit a very important milestone that I promised. 100 million shots of vaccine in people's arms. So when you get your opportunity, get the vaccine, get the shot. It's critically important.
Okay, so that sounds pretty good. That's what he promised. Also, you know, he had been accused of sort of underselling, if you will, that we were well on our way to reaching that goal. And of course, it's kind of unclear if he's talking about 2 shots in the arm, which would be a complete vaccination, or just 1. But nonetheless, it is good. We still have a long way to go, though. So what else needs to happen to get more adults in this country vaccinated?
Well, I think the ultimate goal, Anne-Marie, is to get 300 million shots in people by the end of July. And this is going to be herd immunity. And you heard in previous discussions with President Biden that he has opened these shots to federally qualified healthcare centers, which are these federally driven clinics, as well as a number of drugstores or pharmacies, 6,500 pharmacies to be exact, and then opening it up to having these vaccinations given in churches and in schools round the clock, which will offer the public a tremendous benefit and get these vaccines in over 300 million people, if we can, by the end of July. Now, that would mean herd immunity would be right around the corner.
Dr. Bob, the European Medicines Agency said the AstraZeneca vaccine is safe and effective after several countries stopped using it due to blood clot concerns. AstraZeneca released a statement saying it will implement the recommendations of Europe's health regulation agency. The company also pointed out that these issues weren't any more common than it would expect them to be in millions of people getting vaccinated. AstraZeneca plans to file for emergency use authorization here in the U.S. next month. What should people know about this shot, and specifically as it relates to blood clots? I've seen some research that suggests that you are at risk, at even perhaps greater risk, in getting and developing a blood clot if you're a woman and you're taking some type of birth control or contraceptive pills. What can you tell me about that?
Well, Vlad, your propensity, that means your likelihood of clotting goes up with, say, pregnancy. And certainly, if you're on a birth control pill, your clotting goes up for the average woman about 8 times normal. And this means that there are people out there who are likely to clot when their immune systems are stimulated. Now, this can be very, very significant if you, in fact, have something that stimulates the immune system and causes autoimmunity. And there's a study out of Nature today, which is highly provocative, talking about the fact that, a lot of antibodies are developed in people who have COVID-19 infection. Some of those antibodies are against blood clotting factors, which promote clotting. Now, AstraZeneca unfairly had only 18 people out of, I think it was 30 million, that showed blood clotting, and most of them were women, which goes along with the autoantibody theory that, in fact, the antibodies that are produced against COVID-19 may be rather rogue antibodies, stimulating antibodies against the brain, say, on the blood vessel wall, or other things which may make a person clot if they're genetically predisposed. And that's exceedingly rare. So I don't think anybody should be really concerned over this because it's such a small number of people.
So we've been talking a bit about long haul syndrome, and there have been some reports, no studies, but reports that some people who have experienced long COVID, after they got the vaccine, their symptoms diminished. But I'm wondering if the flip side could occur. Could someone who hasn't had COVID-19 get the vaccine and end up experiencing long COVID symptoms because of an immune response? I guess we're kind of throwing all the questions we can at you because there's still some concern about the impact of these vaccines on people's immune systems.
Well, I think we have to separate this, Anne-Marie, into two parts. First of all, if you have had COVID and you get the long haul syndrome, which is not that rare, we're talking about the formation of antibodies against all sorts of substances, like a substance interferon, which is a natural protein in our bodies against viruses. We all have it. But we can make antibodies against that if our immune systems are primed. We can also make antibodies against B cells, which are the cells that mature to plasma cells that make the antibodies in our blood. So you can develop these autoantibodies, and the condition is called autoimmunity. And I'm sure many of your viewers know what autoimmunity is because they've been affected with diseases like rheumatoid arthritis, lupus, myasthenia, multiple sclerosis. These antibodies are directed against blood vessels, as I mentioned, the heart, the brain, and very important molecules like phospholipids, which is a very big term for a molecule that reflects the clotting factors of the blood. So that, yeah, the long haul syndrome can be the result of rogue antibodies, but it can also be the result of a super duper primed immune system, a cellular immunity response which is overwhelming and eventually subsides and goes away. When you get the vaccine, the same thing happens. Your body's immune system thinks that you're infected, and it acts appropriately. So this is not a surprise to immunologists. What is a surprise is how long the long haul syndrome really continues and how it has affected so many people in different ways, because everybody's immunogenetically different. They've inherited their immune systems from their distant relatives, and everybody's different.
So, Doctor, I just want to clarify, it seems like the same response. You get COVID, you create antibodies. You get the vaccine, you create antibodies. But when some people, when they get COVID, the symptoms linger longer. Could you have the same overly robust reaction with your immune system if you're given the vaccine?
Yes, you could. It's not going to be as substantial, but I have seen patients where their immune systems after the vaccine have made them develop new rashes, new joint pains. Some of the patients get what's called foggy brain, but it is exceedingly unusual, and it will eventually go away. But it has been reported after the vaccine in some patients, and that's a good sign, actually. It means your immune system is really working. And it occurs, of course, very commonly. I guess about 60% of people who actually get COVID have this long haul syndrome, which goes on and on and on for many months.
Fascinating stuff. Dr. Bob Lahita, always great having you on a Friday. Have a good weekend. Thank you.
You too. Thank you.